For next session, I would like to invite Dr. Sagarika Mukherjee as well as Dr. Madhavi Gadkari. So next session is on panel discussion on mind and reproductive endocrinology. For this, we have two moderators, Dr. Sagarika Mukherjee. So just a moment. So Dr. Sagarika Mukherjee is consultant endocrinologist and metabolic physician, diabetologist and metabolic physician from Kolkata. She is visiting faculty at Columbia Asia Hospital, Kolkata. She has a numerous publication as well as numerous presentations. She also is a treasurer for Royal College of Physicians India chapters. And next moderator is Dr. Madhavi Gadkari. She is a consultant in clinical psychology. She is practicing at Jodhpur. She is trained at Nimhans, Bangalore. She worked with various multinational companies like Infosys, as well as she also worked with the Hemophilia Society of India, as well as Pune University. So over to Dr. Sagarika Mukherjee and Dr. Madhavi Gadkari for next presentation session.
Hello, am I audible?
Yes, you are perfectly audible.
Okay. Good afternoon, everyone. My sincere most thanks to Vaishali for inviting me to moderate this session. And indeed, this is a very new subject, but extremely interesting and very much engaging for us because we tend to look at the disorder that we treat, the endocrine problems, in a new light after we know that how can we get psychological well-being and how can we harness your mental well-being and happiness to gear up for disease prevention or control of your metabolic and endocrine disorders. So we've got two brilliant speakers here. Can I have the introduction of the first speaker, please? Right. So our first speaker is Pradnya Kulkarni. She's an assistant professor at Sri Parasurambu College, Pune, and she's had 20 years to teach psychology at undergraduate and postgraduate levels. She's got extensive research experience in field of positive psychology, health psychology, and clinical psychology. She's also done counseling for school children and college-going youths and development of positive psychology activities for different age groups. So first, we are going to listen to the two speakers, and then we shall have a question-answer interactive discussion. Over to you, Dr. Pradnya.
Yeah, thank you very much. Thanks for your kind words. And also, I'm really thankful to the organizer of Synapse, Dr. Vaishalideshmukh. As a psychologist, I'm really feeling good that application of psychology is taught in the field of health. And I really congratulate organizers for this initiative. In this presentation, I'm going to talk about what positive psychology is and its role in the health, in the area of health that we will be discussing. So positive psychology is a relatively new subfield of psychology. It has emerged in last two decades, and it is pioneered by Martin Seligman and other well-known psychologists. It focuses on human strengths and the things that make life worth living. This movement of positive psychology has promoted scientific studies in human flourishing and well-being. So it aims at promoting quality of life using this kind of a positive psychology interventions. So as health is a major domain of human functioning, there is a wide application of this field to promote health and prevent illness. There are two different approaches to the way positive functioning or well-being is conceptualized. One is hedonistic approach that conceptualizes well-being in terms of attainment of pleasure and avoidance of pain. It is commonly referred as a subjective well-being or emotional well-being or happiness. So how happiness, this subjective well-being, it contributes to the human functioning is focused in this approach. Another approach is eudaimonic approach. Now in this approach, it goes beyond mere happiness and it emphasizes on the role of having meaningful life goals, self-realization, excellence, and authenticity. Different constructs have been studied in positive psychology. Here is a big list of that. It includes mental state like flow, which is a state of complete absorption within that activity, which gives rise to optimal experience of happiness and creativity. On the other hand, mindfulness is awareness of the present moment, and it is a distanced observation of one's psychological processes. Both these states significantly contribute to well-being. Clinical studies have documented both physical as well as mental health benefit of these mind states. Positive psychology also addresses positive states of being optimistic, hopeful, grateful towards others, and these states enhance positive emotions in the individual. For decades, negative emotions have been, and its detrimental effect on the health and psychological functioning, it has been studied. But recent study shows that positive emotions can nullify effect of these negative emotions and opens up new thoughts, ideas, and actions. That is, it is known as a broadening of action and thought repertoire, which is helpful in building physical, intellectual, social, and health resources. Positive psychology also acknowledges benefit of positive relations in health psychology. Even researchers suggest that positive relations with others and having supportive spouse and family members makes difference in health outcome. So along with that, even other eudaimonic concepts like having purpose in life, then having a sense of autonomy, then having a mastery over the environment, this feeling of self-efficacy, all these concepts, they have been studied, and clinical study shows that they are positively correlated with health conditions. Let's try to understand this how positive psychology actually contributes to health with the help of one case study. I will read this case study. So Saurabh is a 28-year-old unmarried IT professional, and he is recently diagnosed as a type 2 diabetes patient. He's finding it very hard to accept himself as a diabetic patient. There is a history of diabetes in the mother. He lost his job in which he was happy during the pandemic. He was unemployed for 14 months. He was preoccupied with feeling of uncertainty, low self-esteem. There was no routine. There was lack of exercise, late night sleep, untimely meal. Even since lockdown, he is having very limited social interactions. Though he did not catch COVID, his father had a long COVID, and he had many complications. His close extended family members died in COVID. 4 months back, he accepted another job, though it was not matching his expectations and previous experience. He's not happy with his current job profile. Now, see, in this case, Saurabh is genetically vulnerable to develop diabetic condition. But there are multiple stressful life events such as pandemic, unemployment, health problems, losses in the family. They are definitely contributing to his illness. Now, because of this long-standing stressor, he has started doubting himself. His self-esteem is low. Somewhere, this meaning and purpose of the life is questioned. Hope and optimism, it has shaken. Though Saurabh is not clinically depressed or clinically anxious, but somewhere he is in that state of sluggishing. That is, he is experiencing very low psychological well-being. And this diagnosis of diabetes is actually adding up to these negative states. So though currently he is not unemployed, he has got employment, but still he is not happy with his job. So this experience of flow that is being absorbed in the work is not having this experience. So again, this sluggishing is again affecting his maintenance of healthy lifestyle. It is again having its impact on his diet, sleep, exercise, etc. thus this diagnosis of diabetes is outcome of this negative spiral. This is what actually we can say. So along with pharmacological measures and along with lifestyle management, somewhere we have to take into consideration even these psychological mind states, which are having definitely impact on his health conditions. And with the help of that, we can actually change this negative spiral into positive spiral. So how positive psychology interventions can be used for Saurabh? I'm just very briefly trying to narrate this. So mindfulness-based therapies can help Saurabh in reducing intensity, frequency, and duration of these negative mind states. It can help him to accept current life condition, accept himself with all positives and negatives in his life. He can be more self-compassionate using these kinds of techniques. Though he is not currently happy in his life, but still he has to maintain hope and optimism. So hope intervention activities even can be useful in this case. He's not experiencing happiness in his job, but we can help him to explore this flow experience outside the job, or even we can see to it that whether certain aspects in the job are leading to some kind of a happiness and experience of flow. Due to the lockdown, his interaction with others, it had shrinked to great extent. So building social resources to optimize positive mind states, it can be also work. So in this way, different components of positive psychology can be put into the action to alter this negative spiral into a positive one. Overall, how these positive mind states, they will help in the prevention of illness and betterment of health conditions, that has been stated here on this slide. So positive mind states, they directly benefit physiological functioning in terms of maintaining homeostasis, decreasing allostatic load, and maintaining even rhythms of lipids, blood pressure, better immune functioning, as well as hormonal activities. Also, positive mind states will also have its benefit to health behavior in terms of when person is in a good mind state, they are more likely to have adequate sleep, better nutrition, timely meal. He can be more regular in doing exercises, and the most important is not engaging in drugs. Positive states also has its impact on increasing psychosocial resources in terms of, it will increase person's social support. Person will be more optimistic. There will be sense of mastery over the environment. Self-efficacy will be higher. And as a result of all these things, there will be better adherence to the treatment, and there will be appropriate help seeking. So in this manner, we can say that positive mind states are helpful in the area of health. Here are few studies related to positive psychology intervention, especially in the field of diabetes, which shows that these positive psychology interventions are quite useful in prevention of illness. They are useful in the treatment. They are useful in the promotion and maintenance of the health, especially in conditions, chronic conditions like diabetes or even other chronic illnesses. Positive psychology plays, or even psychology in general plays a more important role because of this chronic illnesses. That patient actually comes across various life challenges. He has to cope up with different issues such as it could be pain, it could be disability. Also, lifestyle management issues are important one. So in management of all these issues, psychology plays a very important role. So we can say that positive psychology has a crucial role to play in the management of chronic illness. Thank you very much.
That was an excellent talk.
It's a pleasure to introduce Dr. Mathangi. She's the professor and head department of Mind, Body, Medicine and Lifestyle Sciences. Isn't it amazing that we have such a wonderful speaker here today to talk about a holistic approach to all sorts of issues and concerns which our patients bring to us. She's the faculty of Allied Health Sciences, Srihar, Chennai. She has done her MSc Medicine, Physiology, PhD, MBA Hospital Management. She's a PG Diploma in Bioinformatics, PG Diploma in Bioethics. She has done a certificate course in Exercise and Sports Physiology. She's a certified life coach. Her experience is tremendous. She has worked for more than 25 years in this field. And it's a pleasure to introduce you, Dr. Mathangi. I would love to hear you, and then we'd like to have a discussion also with you. Thank you so much. Please start. Thank you.
I would just like to share my slides as I start. I hope my slides are visible.
Yes.
Yeah. Greetings from my university, Sri Ramchandra Institute of Higher Education and Research. I'd just like to make this discussion, how I got it is, what is the current level of research in mind-body medicine? Where are we now, and how do we need to focus our research? Where do we get our fund and our way forward? This is the session outlay that I have made. I'm sure all of us were in awe when Dr. Gangadhar presented today with yoga and with fMRI images. And that was like, wow, I think that's a team which is required. If we want to prove whatever we are talking now about mind-body techniques, translate it into clinical practice, we need a research like that. That means there should be these 5 A's, which we call in evidence-based medicine. We need to ask an appropriate question so that the answer has some relevance to a clinical practice. We need to acquire the required talents or required techniques that we need for conducting it. We need it. We need to be able to appraise every step that we are going in a way that the evidence is critically analyzed and apply it as well in our practice. It doesn't stop there because this is a developing field. So that means it's not a closed loop, it's a spiral. We need to keep evaluating it periodically so that this spiral keeps going on till we are able to find an evidence which is appropriate, relevant to the time and space we are in. So with this, if I'm going to go, what's the current status? I think we all go first right away to PubMed, right? Before we go in, we like to have, all of us have some anecdotal experience to say mind-body medicine definitely worked for me. Somebody I tried, you try this. For them also it worked. It was an observation. It doesn't end there. We are all stopping it with that 1 or 2 cases where we find success. We don't randomize it. If we randomize it, it becomes beautiful. The next level, these randomized controlled trial, if we are going to have a meta-analysis on the systematic review, I think we are having a good amount of valuable evidence to say that, yes, it works. That's what we need. Let's take, I'm from an, let's take alternative medical system. If my thing works, if I'm going to keep selling and we are not going to take it from this allopathic side, we need to come together to say that we need to work on it in a way like it can be accepted and bridged beautifully. Where do we go for it? If this is what I did it with PubMed, when I did with PubMed, just with mind-body medicine, there were around 500 papers. Okay, I'm just telling on PubMed. I just put mind-body medicine. When I put mind-body medicine and India, I got only 21. When I put mind-body medicine and clinical trials, there were 47. When I put it as randomized control trials, I got 38. When I put on systematic review in mind-body medicine, I got 29. And when I put on meta-analysis, there is 9. Is it all? If I'm going to take it, this is all. I'm still not right. I have to go further. So I went into the Cochrane database. I hope I were able to see. This was on mind-body medicine. I'm sorry, top one is not going. I'll just go to the next one. I just tried to, that mind-body medicine alone, it had around 1,148 trials. I'm only talking about trial. Please remember what we saw in PubMed. When I went into the Cochrane review, we have 1,148 clinical trials on mind-body medicine. If I'm going to put it along with diabetes, there are 138. If I'm putting it with thyroid, there are 13. I'm not going into anything else, only these endocrine I've taken. I just thought, let me try with yoga, because everybody is working. If I'm taking mind-body medicine, the first thing that comes to everybody's mind is yoga. So if I'm going to take yoga on thyroid, the trials that were there for the last 2 years alone went well. The same way, if I'm going to put yoga and diabetes again for last 2 years, there are 83 trials that have gone. I'm just taking one technique, which is very common everywhere being used, is MBSR. MBSR and diabetes, so far, there are around 39 trials. And MBSR and thyroid, there are 2 trials. So where are we? So we shouldn't stop with what we find in one search engine. Try to search in more to find out what is there. This is a bibliometric article, which was beautifully done in seeing mind-body techniques, how it has been used and where it has been used and all. You can just see where diabetes lies. It has been going more into the mental health rather than into other metabolic disorders. Okay, so if I've just put in what all I have seen, I think now we can know where we need to do our research on. I've just taken, like, if I'm going to split our mind-body techniques as yoga, pranayama, meditation, or guided image, or Tai Chi, or MBSR, or CBT, Qigong, spirituality, music, you can see how many are there. This is from PubMed. I'm not putting it from clinical Cochrane review. You can see how many are there on diabetes totally and how many are RCT. Just look into this on thyroid. Okay, so now we know where do we not have RCTs done, where we need to work on. So we've just identified where we need to do research on. And just put one here, which is health. This is one acronym which has been used in diabetic management using mind-body techniques, which is healthy eating, active living, total health, where it is lifestyle education and individual interactive guided imagery designed specifically to reduce stress and to promote healthy life. So that means it's a physical activity, eating behavior. It's almost like moving beyond, eating less, and exercising more. So such type of protocols is what is required for us to make mind-body techniques get integrated into the mainstream treatment protocol. So where are we now? So we have just seen what is their research is telling. Where are we now? This COVID made everybody realize mind-body medicine is very, very important. Okay, it's probably like only thing what is missing in that is we see that it works. Some anecdotal experience or some people it works. Even in our own cohort, if we see some it works, some it doesn't work. So that means for certain people, for certain temperamental condition, these psychological measures probably work better. Like other things, do we have dose response? Do we have something? I have practiced it for 12 weeks. If I'm going to terminate it, will this good effect of the mind-body technique be there forever? That organic damage, has it been made to organic good health? If that is so, then these are the things which are missing gaps in the mind-body research. So what do we need? A type of study. A type of study has to be unique. We can't do just a randomized controlled trial alone. Probably like N of one kind of study, which are unique for mind-body techniques, which we can take, giving a trial, giving a washout period, giving the intervention, giving a washout period, doing it like that. When we are proving in the same person, it does work N number of times that I give, which is accepted in quality publication in this type of studies also. So we need to know about the different types of research study methodologies. So whenever we want to translate anything into a human research, into a translational medical practice, we need how it works. So we need a basic mechanism studying team. We need to have these mechanisms. Can it be reliably measured? I can have a subjective questionnaire. I can say pain reduces, goodwill is good feeling or quality of life is there. Can I have some quantifiable measure, make it into translation? Then can I do it into an intervention? What type of methodology that I use? Impact and adherence to it. How do I make it? So I need an intervention which needs to be refined and organized. Today we had Gangadhar sir telling like even 12 weeks, we don't know if they will practice regularly. 3 days in a week they practice. We consider this as a full practice. That's what it is. It's not a tablet they are going to take every day. They need to practice it. So the efficacy and effectiveness is beyond comparison of subject A with subject B. So we need to have different statistical approaches as well before we say it is effective in a real world condition. So how do I make my team identify the thrust area for research? Have a rigorous scientific inquiry. Every question that we have put, we need to have a very, very sound research methodology, and the evidence that we are going to see should be really, really strong. Only then we should be able to translate it into a patient care and then bring in a potential change in the way we practice medicine. If we need to do that, what are the challenges that we have? The first one that we have is about the practitioners themselves not knowing. The primary outcome is often subjective. We don't have an appropriate comparator. I can say one group gets yoga. What does the other group get? Is it gym activity or is it walking, or how do we make a comparator group? Is it a sedentary lifestyle? Those are a problem. Compliance in the different practice and the sample size is very, very difficult to get if I'm going to say yoga practice and RCT. So I need to have personal skill. My team should have a technical knowledge about yoga, should have the knowledge about the modern science or basic sciences, as well as the clinical science, and they are able to work as a team. The team is cohesive, good leadership, and the leadership goes on in a like a seamless manner. When we're talking about the yoga person takes the lead. When we're talking about the molecular markers, the basic science person takes the lead. When we're talking about the clinically, how we are going to put it, the clinical person becomes the lead. That type of a smooth transition of leadership is required. And the environment where we are working, that is the organization where we work, should be accepting this type of an integrated treatment modality as well, so that we do not have any interruptions or distraction or stress. We're not trying to work in a closed room. We are working on an open with knowing what are the risks or the preferences the patient might come. He comes to an allopathic hospital thinking that he's going to get only allopathy. There you can't introduce this. If we are introducing it with the consent, that means the ethics has to be really, really very good. So if we are forming all these things, the patient experience outcome is going to be amazing. We're going to get a subjective feeling as well, a well-being. And our measures that we are going to take, be it biochemical measures or the clinical outcome that are going to be measures, are going to be good. So now this makes our organizational outcome also very, very good. So that means for our team should be really good. Our performance result is definitely dependent upon our collective work product. Obviously, each one of us in the team will also grow. But the three important things that we need is our skills. Each one of us have come with our unique skill set. So that is the cohesion that we need. Each one of us are committed with a single purpose, integration, towards making mind-body techniques get seamlessly integrated into the modern medicine practice as well. Accountability even to the smallest level. If we can bring all these things, this is what we need here. A collaboration which is very, very cooperative, a homogeneity in spite of the heterogeneity that is there in the team, a very, very tolerant team which is ready to receive the constructive feedback from every team member. I've just put this one article, consciously taken it. It is more on a renal dialysis patient. Just see the number of institutions that have got involved, the variety of departments that have got involved here. This is what the need of the hour here, a multidisciplinary team, a cross-institutional collaboration, an open platform for data sharing, a seamless support and resource sharing is also required for us to develop our team. This is a conceptual model for any complementary alternative medicine to get integrated. We need this integrative medicine. It is only a shared decision making. So what we need now is an ideal candidate selection protocol, a customized mind-body protocol, a well-defined or designed clinical trial, which can bring in all these gamuts which anybody looks into in any mind-body practice. So the strategic plan that we need to have as a team is What is the theme? I've just taken every diabetic we can't take, which is where I want to focus on. Let's take that particular thing to work on. Work on promotion of health as well as disease prevention. We need to work on symptoms management as well as the other things. What we need is enhancing the research workforce and dissemination. We have good fund as well. When we want to do research, how am I going to do? We have the DST COVID Satyam as well as CCRY and Ayush funding. NIH also has funding. I just love this. NIH has one more funding only for mind and body clinical trial funding opportunities. We need to have something like that in our country as well, not just only as Ayush. We need to come integrate like this. A capacity building also requires, I just take this opportunity to also tell about the program that we have in our university, probably the first of its kind in India. We have a master's program integrating mind, body medicine with lifestyle sciences as well. This is an internationally accredited program as well, where we make them to understand all these concepts of mind-body techniques and how they can be delivered as well. So we need to have manpower who can understand both the sides of system as well. So to summarize, we need to develop and validate a structured protocol specific for the disease or condition, identify the quantifiable parameters, develop the criteria which are very specific, which could be also practiced and standardized. Dose response relationship could also be made. We need to bring in the science behind why it is successful, the neurobiological mechanism, making clinical trials with innovative study design like the N1 type of study, making complementary health approach and integration into our health delivery in itself. So what we need is not use each one of us independently. Best, let's all work together as if like art is I, but science is we. We need to join hands. And this is an opportune moment for us, because COVID has brought all of us together on one platform when we could fight a pandemic. If we could do it for good health, I think there is nothing beyond that. Thank you.
Thank you very much, Doctor. It was a wonderful presentation,
Thank you.
which has given us a very holistic approach to not only how to do research, how to develop a team, and look at the issues and concerns from a 360-degree angle, which Dr. Pradney also very beautifully put across, mentioning that we need to look at all the aspects of the human being that we are dealing with. It is not just the disorder, it is beyond the disorders also we need to look at to get the best outcome, that we are giving in so many inputs in terms of whether it is the medicine, whether it is any treatment modality. I was listening to the previous presentations also, and I do realize that all of us are beginning to feel the need to get into the multidisciplinary teams. Ek akela kuch nahi kar sakta hai, saath hi haath badhaiye. So let's move into that. And Dr. Vaishali, many congratulations for bringing all the different professionals onto the same platform. Hearty congratulations, and I hope all of us can take it forward in a very meaningful way for the betterment of not only our patients, but overall health of all. Thank you. Thank you so much. If there are any questions, do we have the time?
I can't see any questions in the chat box, but
yes,
I've got a couple of questions. Now, as a practicing endocrinologist, you know that we focus a lot on prevention of diabetes, because if we can prevent diabetes, that's the only way that how the epidemic can be brought to a halt. Is there anything about positive psychology which can be applied to the population as a whole to teach them about lifestyle changes, to come away from the westernized lifestyle, to have more exercises, have healthy eating habits? And positive psychology be applied on a society as a whole rather than individual persons?
Wonderful question, Dr. Sagarika. In fact, that is the aim of all treating teams, whether it is doctors, whether it is physicians, whether it is psychologists, whether it is mind-body experts, whether it is in terms of yoga. Everybody's trying to move in that direction, that how can we develop our own model so that we can work towards the betterment of the individual patient that we have in front of us. So positive psychology definitely gives us that holistic or a 360-degree view of the person. We just not focus only on these are the parameters which are not okay. These are the parameters which are disordered. But what is still healthy in the person? Can we enhance that healthy part of the person? Focus on the strength of the person in spite of the disorder category that has happened into the person. So, focusing on what the person still can do well, appreciate, encourage, and then help them to look at the so-called disorder in its proper perspective, rather than this is the end of me, that nothing can be done, let me be the way I am, or losing their motivation as such. So looking at it from a holistic perspective is definitely the way forward.
Another interesting thing what I learned from Professor Mathangi's slide, one of the slides you've shown that mind-body research, the maximum number of research for mind-body has been in areas of cardiovascular disorders, and diabetes falls much lower. When a person gets diagnosed with a heart condition, people become very serious and very motivated that yes, you have to have a healthy lifestyle, you must do yoga, you must take your medicines. But when they become diagnosis of diabetes, the perception is diabetes is just to do with sugar, is nothing to be so much conscious about, it can't cause any harm. But whereas diabetes is the mother cause of all of these cardiovascular disorders, which we don't realize. So maybe as a society as a whole, some message must come from maybe from top onwards to the society as a whole, that how to harness healthy lifestyle, how to improve your eating habits, get into exercise habits in order to prevent these metabolic disorders and live as a better society.
Very true. Very
Yes.
true.
Yeah, very true. And I think this work has to be initiated, right from the school. So
absolutely.
Yeah, so actually group interventions, or rather we can call it as it is a psycho education or educative work that has to be done along with positive psychology components, so that it will be more effective and that message will be actually reached to the masses. So this is a primary prevention thing, and even promotion of good health habits. So with that respect, definitely mind-body medicine interventions are very essential one. In India, we are, these interventions and rather this interdisciplinary work is at very infantile stage. But I really feel good that this is a very good initiative, that on this platform, different practitioners are coming and a good discussion is going on. So I think after this conference, there will be many initiatives into the practice, and our patient population will get benefit of that. Yeah.
Just wanting to add one thing, Dr. Sagarika ma'am. Like whenever it's a cardiac problem, immediately we know that my medical bill is going to be very big. That scare makes them to go for anything that can control their cardiac problem. But when it comes to diabetes, it's only go for regular walking, control your diet. When we tell them that lifestyle is the only thing, they just belittle the disorder itself. They don't realize, like, as you rightly said, this is what will lead you to cardiac problem. If that scare is going to be given, instead of us being so nice and polite with the patient, give them the scare. If you're not going to control it, your bill is not going to be 1,000, it is going to be 1 lakh. If you want to give that 1 lakh to the cardiologist, please give. I am telling it to you with 1,000. So I think that scare should come there. I mean, probably it's a negative psychology, so that they work on themselves instead of paying it to the cardiologist.
Other thing, the areas where we struggle with management of chronic disorders, be it diabetes, thyroid, cardiovascular disorder, anything, but more so with metabolic disorders, we don't have very much pronounced symptoms like diabetes, thyroid. Compliance becomes a very big issue. Once you're diagnosed, say with diabetes, it comes as a shock to you, for the person, for the entire family, that you've got diabetes. Once you get started with medication, you follow your diet, lifestyle, and within 3 to 4 months, you have a presentable metabolic parameters, or lab parameters have improved, and then you take a back seat and say, no, let this carry on, and then the compliance becomes a little bit loose, and then that's the point where we struggle. That you may think that it's not a problem, that if I can have a feast one day, it's not a problem. If I miss my medicines for a couple of days because the local pharmacist doesn't have it, I can't order it online. So this is the area where we really struggle to meet ends or to establish control for the parents. And maybe mind and body medicine can have some impact positive psychology can have some impact in harnessing the goodness in you, harnessing the happy feeling in you, positive emotions to say that my well-being is in my hand. Now, no, it doesn't matter if I'm diagnosed with diabetes, but still, this is my life. My glass, if you have a glass full of water, rather than saying that it is half empty, say it is half full. So that is where, if you harness it, the positive strengths, maybe will be a better society and the disease load might come down. But again, it has to come as a big message, maybe from the media houses, from schooling, and maybe from some top personality, you know, someone who is very, very prominent, and if messages come from those, and it hits the masses.
Definitely, fully agree on that. We have seen when we were school kids, like measuring our body measures, like not just height and weight, even circumferences were measured. If only those things were also into the grading system, childhood obesity would not be there probably. I always keep thinking on that. That's no more there in the children in their school. Only their maths, physics, chemistry is there.
We have any more questions? Madam, you've got any more questions?
It was wonderful listening to all of you, as well as, you know, looking at the integration of the treatment programs. Thank you so much. Thank you, Dr. Vaishali.
Thank you. Fabulous program.
Thank you, Vaishali ma'am.
Thank you. It was lovely to hear all of you, and a lovely discussion. Since morning, I'm hearing this program, and I think Dr. Deshmukh has done a wonderful job of getting all people together on that platform, and each one of you have given new insights and new, you can say, food for thought for us as an organizing committee. I hope to see you all in person next year. But definitely, I love the interaction with even the virtual platform, Dr. Usha ma'am, Dr. Mala madam, Dr. Chetan, Dr. Aarti, and the whole panel discussions done by eminent panelists. I think it was a varied discussion on, and you really can't imagine how integrated our branches are and how we can make them so, you can say, merged together and beneficial for each other. So thank you all for coming to this platform, and nice to have all of you. So over to you, Dr. Deshmukh.
So thank you, Dr. Sagarika Mukherjee and Dr. Madhavi Gadkari, sir, madam.